Okay, class, in this last smallest section, it's just doing a quick comparison between the male and female, um, and it helps explain why sometimes females do get more UTIs than males. So let's take a quick look at that. Again, here are the ureters. Here is the urinary bladder. Here is the internal urethral orifice. Here's the external urethral orifice. Here's an external urethral sphincter right here. Here is the trigone. The trigone is just this triangular region where we have these uteral openings and the internal urethral orifice. When you combine these three, it's like a funnel of a drainage of urine from the urinary bladder into the urethra. Okay. So the discharge of urine involves voluntary and involuntary muscle contractions. There are stretch receptors that trigger a spinal reflex, which we learn to control in childhood. And the urethra carries urine from the internal urethral orifice to the exterior of the body. In males, it discharges not just urine, but it discharges semen as well. So if we compare on the left, the male and the female on the right, in the box here on the bottom right is really the take-home message here. The urethra is 5 times longer in the male than in the female. The urethra is divided into 3 segments in the male, right? If you look at the male on the left-hand side, there's a prostatic urethra, which is the part of the urethra through the prostate gland. There's the intermediate urethra, and then there's the spongy urethra. So in the males, it's divided into females, but in males, it's divided into 3 regions, but in females, it's just one short tube. So because it's much shorter in the female, and the other reason of UTIs is not just a shorter urethra, but also the proximity to the anus. So if there's improper wiping, which goes from posterior to anterior, you could bring bacteria from the rectum or from the anus into the vaginal region here, and from that bacterial issue reaching into the vaginal area, which can ride up the urethra into the urinary bladder. This can lead to severe urinary tract infections, severe. The urethra is a common duct for the urinary and reproductive systems in males, whereas these two systems are entirely separate in the female. So in the male, the urethra is not just for urine, but semen and sperm exit through that. In the female, there's one exit for urine, there's one exit for baby, and there's a separate exit for stool.